Hi, this is Dr. Jared Garrison. I'm the medical director for Valley West, and I'm going to be talking about some general concepts with COVID-19 in the nursing home. And the reason for the video is I was doing weekly lectures to the daytime staff, but of course, only half of the staff get that in the week, and then the night staff never get that. And so this is an attempt to kind of get some information to everybody. So just as a real brief introduction, so COVID-19 is a potentially life-threatening virus. When we look at it, about more than 40%, about 42% of the deaths that have happened in the United States come from the nursing homes, and about 25 to 30% of nursing home residents who end up contracting COVID-19 will die from it. Unfortunately, there are many symptoms, and there are very few treatment options. And one of the other things is that human behavior is really makes a big difference with COVID-19. And so we're going to talk a lot about the things that we can be doing to try and help protect our residents, our staff, and ourselves. So human behavior. So human behavior determines the disease. It determines if our residents get sick. So if we stay home when we're sick, when we wear a mask when we're with the residents, those things help decrease the chance. Or if we can get our residents to wear a mask, that helps protect our residents. It determines if other staff get sick, right? So if we take off our mask when we're at the nurse's station, then we get other people sick. Or break rooms, that's another really common one. And it determines if we get sick. So having all of the PPE in the world, if we're not wearing it properly or if it's not fitting correctly, then and that's all human behavior. That's all what we do. What we do makes a difference. And if we're paying attention to the symptoms, if we're really watching our residents and we notice a difference, then that allows us to be able to hopefully catch things early so that it doesn't spread to other residents in the building. And picking up those symptoms early is really a big thing. And then when we do pick them up, making sure that we isolate the patients so that we keep them from spreading it to other residents. So in the end, really, most of this comes down to us, right? How are we going to handle? What are we going to do to help keep COVID-19 from continuing to affect our residents? There's some primary things that influence whether or not people end up contracting COVID-19. So the infectivity of the person, and we'll talk a little bit about that one, but you have to have somebody who's infectious. Proximity, so the closer you are for the longer period of time, the more likely we end up having contracting COVID-19. And the time is one that's kind of an interesting one. So in my role as the county health officer, we've been able to track down where people contract COVID-19 about 90% of the time. And with those 90% where we know where they contracted it, all of them had exposures that were for less than 6 feet, more than 15 minutes with no mask. Every one of them. Every one of them. And the reason why that time seems to be a predictor is we send out those little respiratory droplets, and we probably have to get enough of them inside of us before it actually causes us to get sick. So kind of like a urinary tract infection where you have to have greater than 100,000 colony-forming units. There's like a trigger where you get enough of them, and then that's where it makes it sick, where it makes you sick. And so if we can limit the amount of exposure, the amount of time that we're in a room and we're close to people, it makes a difference. And then barriers. Anything we can do to put some kind of a physical barrier, it makes a difference. So that can even be things like using the privacy curtains. That will help decrease the spread of COVID-19. Plexiglass, whatever, anything we can put something in between, that makes a difference. So how is COVID-19 spread? Well, primarily respiratory droplets, and I think probably most people are aware of this, but anytime we cough, we sneeze, we even breathe, we send out these little respiratory droplets, and that's where the COVID-19 can be. And the receptors for it are in our eyes, in our back of our nasal passages, and in our lungs. And the main place is in our lungs. Okay, So that's these respiratory droplets getting into here is where it's dangerous, okay? And then person-to-person contact. And so that can be, somebody, I don't know, kissing them. Can be even that they cough into their hand and then they touch the other person and then that person touches their eyes, but from one person to another. And then fomite. Fomite is where it goes from person to an object to another person, okay? So it could be like you cough into your hand and then you touch a door handle and then somebody else touches the door handle and then they touch their eyes and then they get infected from it that way. We know that it happens. It doesn't happen real often, but we know that it happens. And so we need to be aware of that, okay? If you're sick, stay home, okay? When we look at where COVID-19 gets into the nursing homes, it's from us, it's from the staff, it's from the workers, the nurses, anybody. As caregivers, I think oftentimes, especially when people are a little bit short-staffed, the temptation is to come in and, I'm going to help out. Or, gee, I got to be there for my residents. But the reality is when you do that, you put everybody at risk. The residents, the staff, everybody. When you are sick, stay home. Please, 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 please. And want to make sure that everybody's aware the Valley West does not penalize people when they stay home due to being sick. So this is something kind of new. We're really hoping that people will start to pay attention to other people. And when you spot somebody who seems like they're acting sick, whether they look sick, when they act sick, or whether they're coughing, please go ahead and call management. Let them know. Let them know. Or even if you felt comfortable to go ahead and say, hey, gosh, it seems like maybe you're sick. Gee, do you think that's the best thing to be doing and be sick during, the pandemic? I don't know. We need to try and we need to police each other. We need to do everything we can. I know that having that conversation is a scary thing, but it potentially saves lives, right? I mean, it really, really does. Really does. I'm hoping that staff will care enough to be able to open their mouths. These are the symptoms of COVID-19. It's taken from the CDC. So we got fever, cough, shortness of breath, chills, repeated shaking and chills, nausea, vomiting, and diarrhea, muscle pain, headaches, sore throat, new loss of taste and smell, nasal congestion, and runny nose. Just two ones to bring up that maybe we don't necessarily think of as the nausea, vomiting, and diarrhea. Okay, this tends to be an earlier symptom. Okay, and the loss of taste and smell. And for whatever reason, the experience with COVID at Valley West, the staff tend to get this one, and we usually say that about 70% will end up having a loss of taste and smell, and about 12% of the time it's the first symptom. So this is a one to pay attention to for staying home. Interestingly, when we ask the residents, because I've been asking the residents, not one of them has fessed up to having loss of taste and smell. A lot of the staff members, but none of the residents. So kind of a little bit interesting. So many of the residents and staff will have minimal symptoms, okay? And so, and this is especially true early on. And you'll see later on, we'll talk about it more, but prior to developing symptoms and the first couple of days after symptoms start is probably when we're most infectious. And people typically don't have a lot of symptoms when they first start having symptoms, okay? So it can be simple things like being tired or sleeping more, low O2 sats, decreased PO intake, weaker, more confused. Interestingly, when, I heard that there was lots of asymptomatic people, when I started going through and really asking, especially the CNAs who typically know the patients better, and we started talking about PO intake and things, there were some telltale signs that these people were having symptoms. So this is, so when are people the most infectious? Just prior to symptoms and early when symptoms are mild, okay? And this is taken from the CDC. It says, a large contact tracing study demonstrated the high-risk households and hospital contacts did not develop infection if their exposure to the case patient started 6 days or more after the case patient's illness onset. okay? So what they said was, I don't really like that sentence, but what they're saying is that from the moment you start having symptoms, you're infectious, and probably you're not very infectious. Well, they couldn't show that it's spread after 6 days after symptoms started. So kind of an interesting little thing, isn't it? And so, you know, when we got our test results back, and it took, you know, 7, 9, 12 days, whatever it was, we didn't do a lot of moving of patients around. And this is part of why, was we didn't want, we knew that the people were primarily infectious early on, and we didn't want to move a bunch of people and potentially take people who were, who had contracted COVID-19 from a roommate and move them in with a new roommate when those people who we got the test results back and they were positive probably really weren't infectious anymore. Okay, so I don't know if that makes sense or not, but that was kind of some of the thought process with not making lots of room changes. So something new. So we're really going to be trying to monitor symptoms and any change in conditions. And this is until we can get good testing with, testing with good turnaround time. We're going to have to rely on symptoms so that we can pick out, gee, who's starting to have symptoms so that we can isolate them and keep it from spreading to other people. And that's really the only way we're going to be able to battle this until we can get, you know, better testing, along with our personal protective equipment and doing those things. But recognizing and isolating is going to be one of the main things that we can do. So we're going to monitor for any change in conditions. Often the CNAs who know the residents well are going to be the ones that are going to give the best information. What's going to be discussed at the beginning and the end of the shift, and anything felt by the nurse to be significant will lead to a call to the provider, okay? We don't want to sit on this and wait a couple of days. We want to act now. We really, really do. And some things that would cause to be, you know, a call would be fever, some low O2 sats, new cough, sore throat, headache, loss in taste and smell, you know, vomiting, diarrhea, you know, changes like that. Man, we want to isolate them right away. And we probably want to try and keep their roommates from, you know, having somebody else come and be a roommate, okay? And then we're gonna, for those that are kind of more mild, you know, like, gee, maybe they're just eating a little bit less and doing things like that, we're gonna go ahead and please keep note of that. And then Maxud or I will be in there at least twice a week, either doing in-person rounds or video rounds or your telehealth. And we're really wanting to try and nip this in the bud and to keep it from spreading anymore, okay? And so we're gonna be doing everything we can to make that happen. Okay, so why is PPE important? When, you know, going back into talking about the county health officer role, when we look at who it is that ends up contracting COVID-19, it almost always ends up being family, friends, and loved ones. You know, that's really, that's who the primary people that are exposed. That and people who work in similar work environments, but it's people getting together and hanging out, and family living together, and people working together. So when you wear your PPE, it protects your family. It protects your friends, right? Because you contract it, you take it home, and these are the people who are going to end up paying the price for it. So when it feels hot with that N95 mask and it's not comfortable, think about your family. Think about your family. And it protects other staff, right? So when we're wearing, when I'm wearing my protective equipment, it protects everybody else. And same thing with them, right? And it also protects our residents. And once again, 25 to 30% of the people who end up in a nursing home, who end up developing COVID-19, are probably going to die, okay? This makes a difference. This makes a difference. What you do makes a difference. So this kind of famous picture from the CDC, and you can just see all these respiratory particles that are just flying towards me, right? And you can just picture a whole bunches of teeming with, you know, little, you know, baby coronaviruses ready to get inside me and make me sick. So what can I do? The reality is that personal protective equipment really works. And there's a wonderful study that I really like. And it's, I don't like the name of it, but it's called Physical Distancing, Face Mask, and Eye Protection to Prevent Person-to-Person Transmission of SARS-CoV-2 and COVID-19, a systematic review and meta-analysis, okay? So what they did is they took all the literature in the world, right? So it ended up being 172 studies. They took it from 16 different countries. I think there was 6 different languages. It was 6 continents. I mean, they scoured the world. They took all of the data and they tried to say, gee, how much difference does it really make when we wear our personal protective equipment? And this is what they found. So physical distancing, and what they use for physical distancing is 1 meter. So that's about 4 feet, okay? And so they found that by being 1 meter away, you are 5 times less likely to end up contracting COVID-19. So that is just literally taking a half a step back during a conversation, and you're 5 times less likely to contract COVID-19. The study also has a nice little graph where it shows that, gee, if you make that farther, the distance the more distance, the less likely the spread is. And so when you get to 6 feet away, it's like 8 times less likely. So distance makes a difference, and I think sometimes we forget about that. But we want distance between us and everybody, right? That just protects everybody. So 5 times less likely, 4 feet, right? More distance, the better. Face masks, okay? 5 to 6 times less likely to contract COVID-19 when we have a face mask on, okay? Makes a difference, right? Not so much if you're wearing it on your ear, you got it on there, you got it on right. It makes a difference, 5 to 6 times less likely. Eye protection. So like I mentioned, that we have those receptors in our eyeballs, in the back of our nose, and in our lungs. And that's the main places we have. And so it's not surprising that having some kind of eye protection will help protect us. And, and that's by 3 times, about 3 times more likely to be not to contract COVID-19 if we've got some kind of eye protection. And for me personally, it kind of makes sense that if you've got a face shield, that's going to protect your eyes, and it's also going to help protect, it's going to be a barrier that's going to help protect your lungs, okay? So these things really do work. These things really do work. Not the best study, but it's the best information that we have. So taking advantage of distance. Keep exposure to residents and staff to a minimum. So the farther you can be away, the better. So if you can talk to a resident from the door, as opposed to being in there real close, and we want to do that. Meetings. We want distance in meetings. We don't want people shoulder to shoulder in meetings. Break rooms, nurses' stations. We want space in between. I mean, that just once again, that protects everybody. One of the things that we like to start having nurses do is use the bedside tables and just spread them down the hall a little ways, right? You can still talk, you can still do those things, but once again, 4 feet apart, and all of a sudden we're 5 times less likely to end up contracting COVID-19. It works. Please, 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 please utilize that distance. Avoid the break room. Break rooms are a disaster. They're a disaster. When I have gone into different businesses and we have looked at where COVID-19 spread occurred, it's the stinking break rooms. If we just avoid it. What I usually do is I usually go out to my car, turn on the air conditioner, and eat my lunch in there. I'm not going to get COVID by doing that, right? So that's avoid the break room. When talking to staff and residents, just take a step back, and everyone should be considered infectious. So like I said, a couple of days, 2 days before symptoms start, and 2 days after, and then a few days after symptoms start, up to about 6 days. So we get about an 8-day window when people are infectious. And so, but a big part of that is when they have minimal symptoms. So we just need to pretend like everybody's infectious, and if we do that, it will protect us. PPE only helps if used, right? And you could even say that It works a lot better when it's used appropriately. And, not underneath the chin, not hanging from the ear, not with the nose sticking out. There's a wonderful PBS video where they do some special camera work and they can see with the vapors coming out. If you have a mask on and your nose is sticking out, it's almost like you're not wearing a mask. It really just doesn't make any difference. Please keep your nose tucked under. If you see someone not using their PPE, please remind them. Once again, I know this is a hard thing to do, but it really potentially could save somebody's life. No. It probably, if you're willing to do it and to consistently do it, I can almost assure you that at some point or another, you will save somebody's life. Do it. I know it's scary, but please do it. So how do you know if your mask is working? Well, it's important to make sure that the N95 mask that you have, that you've been fit tested for it. So I'm really hoping that that everybody has an appropriate N95 mask. We are going to be having some people come into the building and redoing fit testing and making sure that everybody has an appropriate N95 mask that has been fit tested. And then a seal check. And I don't know if everybody knows that, but essentially what you do is you put your mask on, and with the N95s, you have one that comes above the ear and one that comes below the ear, right? We don't crisscross them, we don't do any, that's the way it works, okay? And then you blow into it, and if you feel air coming out, then that means that you don't have a good seal. There's something wrong with that, okay? And so, you need to get another mask, okay? That one's not working for you. Maybe, or try and readjust the straps or refit the metal piece or do something, because you should not feel air escaping around the outside of the mask, okay? And the same thing when you suck in air, if you feel cool air coming in one particular place, then you've got a problem there. We need to readjust, we need to get you a different mask, okay? Talk to your PPE coach if you've not been fit tested for the N95 you have, or if you leak on the seal test. Other pitfalls with masks: avoid touching them, right? So we got the mask, we've got COVID or coronavirus out there, and we breathe in, and that mask does just what we hope it does, and it stops it from going down into our lungs and getting us sick. And so that outside of the mask is all infected. And so when we touch it, we need to assume that it's infectious, and we need to wash our hands, okay? And don't touch your eyes. Please don't touch your eyes. Especially don't touch your mask and then touch your eyes. And don't pull your mask out when you're talking, right? That just makes it so that you're sending respiratory droplets out to everybody, right? Use the straps to adjust, right? So, we try not to grab the outside of the mask. We use the straps. Do not take them off at the nurse's station. Do not take it off at the break room. You just put everybody at risk when you do that. Hand hygiene. Foam in and foam out of each room. After each time you touch your mask and before touching your face, right? So our face is the danger zone, and we really want to do everything we can to try and protect that. In conclusion, COVID-19 can be a very dangerous illness, especially for our residents. But there are many things that we can do to decrease the spread. Staying home when we're sick, watching for early symptoms in our residents, physically distancing from others, wearing the appropriate PPE, and holding others accountable. And I think that maybe in some ways, the secret to our success is going to be holding each other accountable. I know it's not an easy thing, but once again, we've gone into healthcare for caring for those who can't care for themselves. And that's what we do in the nursing home. And I'm hopeful that we will have people who are brave enough to rise to the challenge and to open their mouths and to remind people. And I don't think you need to be ugly or mean, but just say, hey, it looks like you got your nose sticking out there. Hopefully that'll be enough. If it's not, talk to management. But we've got to hold each other accountable if we're going to be able to beat this. I hope this was helpful. Thank you very much.